Each hospital patient has his or her own unique set of needs, and there is correspondingly a wide array of medical systems that ensure the patient is assisted and monitored. What is not unique, but rather common among most hospital operations? A staggering number of cords, cables, tubes, and hoses that are required to effectively assist the patient. It doesn't take a hospital nurse to tell you that a large number of cables and tubes can quickly become a tangled mess. I'm sure many of you at home have experienced this yourselves, just trying to organize your computer cables. Furthermore, hospitals are often forced to haphazardly stow excess cables on the floor, presenting a tripping hazard. To make matters worse, the hospital is a very dynamic environment. Patients are constantly on the move. Effective and quick organization of all of these cables, tubes, cords, and hoses is needed even more in such an environment. The National Institute for Occupational Safety and Health published a study in 2009 that found that slips, trips, and falls accounted for 25% of all lost workday injuries among hospital staff, making it the second most common lost workday injury. To frame the problem in numbers, 16,000 cases of injuries from slips, trips, and falls have been reported in 2009 and cost the healthcare industry over $1 billion in losses. Not surprisingly, loose cords, hoses, wires, and medical tubing were found to be a major contributor to the reported injuries. Clearly, a solution to this common hazard is needed. There are products on the market that attempt to solve this issue. Some products offer a base to organize cables and tubes with, but these products fall short as they are not adjustable to accommodate different sizes of cables or tubes. You cannot adjust how tightly the tube or cable is gripped, and some are single use as they are not durable enough to be cleaned with the harsh chemicals required in a hospital setting. Other metallic products offer a more permanent solution but cannot be quickly removed or rearranged and are really better suited for tube or cable storage in a static environment. Obviously, there is still a need for quick, effective, and versatile cable or tube management in the hospital setting. Well, look no further. Now introducing the Corganizer. The Corganizer consists of a base and straps. The base is wrapped around something like a bed rail or IV post and snapped together using metallic buttons. The base and straps are made of medical-grade neoprene, which makes the components flexible. Medical-grade neoprene is also able to withstand repeated cleaning with harsh chemicals, making the product reusable. The base can easily be snapped together by simply pushing the button through the interfacing holes and can be adjusted as needed for whatever the item is mounted to. Cable straps are made of the same medical-grade neoprene and utilize the same metallic buttons as the base. They snap onto the base and snap together to secure cables or tubes. Straps can be easily added and removed as needed. Multiple colors are available for purchase so hospital staff can color code straps to help organize and identify secured components easily. And the straps are free to rotate about the mounting button so that they can be optimally oriented depending on the situation. To use the strap, the end opposite of the button end is brought up and over the button is snapped in, and the excess strap is routed through the loop. Cables are then routed through the loop and the strap can be adjusted for preferred tightness. Or the cables can be routed through the strap while it's still open and the button can be snapped easily with one hand. Hospital staff can purchase the Corganizer through the Corganizer sales website and a medical supply store near you. While the Corganizer was inspired by needs in the hospital, quick and effective cable or tube management is certainly needed elsewhere. The Corganizer could also be utilized in industries like high-tech manufacturing and even home electronics, opening up additional distributors like McMaster-Carr and Best Buy. Because, let's face it, everyone could use a little Corganization. The Corganizer. Why organize it when you can Corganize it?